So they capped the well, and you decided, okay, I can bring my family home.
That was the assumption, that you could bring him back.
How long was you home before you started realizing that that wasn't the right decision to make?
Let's see, we got back the first part of August. Probably within the middle part of August. I would say about the middle of August. We done knew it was going to be bad. Well, they were still burning. So you could still smell the chemicals every single day. Your filters that you put in your things, I don't know if you do them at your house, change out your filters. Within a week, they'd be black. So you're going to tell me they told you to stay inside and leave your ACs on. Okay, then you go check your filter and it's black. So how is that helping?
I have friends that are sick, that's been sick since the spill. I have a 2-year-old grandson, he's now 3, that has been sick since September after the spill in 2010. His immune system was so low that they couldn't detox him. So they've had to just naturally try to, with eating habits and things like that, to try to get his immune system built back up.
She'll be 12 in May, and they have said she has acute sinusitis, stomach problems, which she's taken that, whatever that name of that medicine is. I've had to pick her up multiple times from school since the spill. I never picked her up before. She has stayed sick and missed more school now than she's ever missed before because of her stomach. It just bothers her, and she swears it's killing her.
And just off the top of your head, if you could guesstimate about how many times that he's been on antibiotics since the spill started.
I would definitely say at least 11, maybe 12.
Upper respiratory problems or fevers for no reason, things like that. But you can't take him to the doctor because most doctors just want to give him antibiotics, and that's what helped destroy his immune system in the first place.
Viral and bacterial infections at the same time. I mean, she's like, I wondered why the influx of kids this year has been so bad. I said, what do you mean? She said from Port Sulphur down, she's had more sick kids this year than she's ever had in all her years of being a doctor.
One's 2, one's 5. Those are my grandchildren. And it's just, I mean, runny noses all the time. They never used to have that. And breathing problems continuously. Both of them are diagnosed with bronchitis. The 5-year-old, they think it may be chronic bronchitis. I mean, she never had any of these breathing problems before the spill. And they say that, well, they're going to do more testing and this and that.
So what has the doctor said about your kids' cases in particular since you've brought up the chemical exposure issue? Has she talked to you or had a conversation with you about getting them tested for chemical exposure?
That's why they went through that process there and talked to these people. You can see on there, she did ask them what Medicaid would cover. That's why we want to make sure and find out and see, you know, what they could do. And this is what they want to send back. You could see all her different things where they tried asking about the PHA levels and this and that. They tried, and the seafood's going to send them this, trying to say
and this is what
okay.
They sent back. So this is from the Department of Health and Hospitals, State of Louisiana, United Justice, Seafood Update, dated October 14, 2011. Due to the recent oil spill in the Gulf of Mexico, there has been a great public concern over the safety of Gulf seafood. The Louisiana Departments of Health and Hospitals, DHH, Wildlife and Fisheries, Environmental Quality, and Agriculture and Forestry are committed to monitoring Louisiana seafood to ensure it is safe to eat. Officials with these agencies are aggressively pursuing a long-term seafood safety and monitoring plan.
That's their nose for their sinuses. This is for chest congestion, Aldex. This is Dry Max for all 3 of them. This is allergy medicine. Yep, it's another congestion medicine. This is all breathing treatment.
for his breathing. This is Openex, but it has gotten so bad lately. There's his name. This Openex isn't working. Will you hand me that little pack right there in front of you? It's the Pulmicort. So they changed him to this, which is a lot stronger, which you got to take these 2 together.
Okay.
All right. This was for a bacterial infection At the same time, they had to have this for a viral infection.
You ain't got a favorite medicine though.
For her math, her another form of treatment. This is
Did you have to do any of this before the spill?
No.
No.
This is all treatment. And I just cleaned up this out.
Try to get them on a healthy diet and stuff, and then they'll just wake up, I mean, and be throwing up. And sometimes it'll come out green bile, you know, and no reason or rhyme for it. They both ate the same thing, and they're not always sick at the same time.
This was for his Bactrim. He also took the clindamycin. That was supposed to be for a staph infection from a little bitty splinter, which was horrible. His blood count was up over 15,000, which should have been hospitalized. She ended up there going through so much Motrin, she started giving it to me prescribed, so I wouldn't have to keep buying it because of the fevers. This, they just gave him the other day, which is Drymax, and it's for upper respiratory, congestion,
It tastes like
cough,
berries.
sinuses, everything. Along with this antibiotic, which is Omnicef. I have no idea, but it's non-refrigeratable and it's supposed to be very strong. It did miracles because he couldn't breathe and it worked.
It's nasty, Ethan.
Okay, for Ethan, at the same time, they gave him azithromycin, which is one of the strongest antibiotics, as you know, because there was something infection that they didn't know what it was, bacterial, so they gave him this. Okay, Ethan, Vivaran. This is a cough syrup that's supposed to help him be able to breathe better. Okay, and there's more of these is Ethan's. His Nasonex. You can't just throw all the antibiotics away, son. Oh my God. And this one. How did that taste?
It just doesn't feel right.
That was for viral. This was for excessive hives. That was, let me make sure this is right. This is after we got back from Maine. This was August, this was September.
When I was 7 years old, I was swimming until dark. I was playing from daylight till dark every day. I didn't even have to come in the house but to eat.
To bring them to the doctor, all they could say is, well, they got bronchitis. You know, oh, they're getting a cold. Well, what's the green stuff from? How come they're always throwing up, you know? 2 or 3 times a week. They'll be just throwing up for no reason at all. And I know it's not from the food because we got them on a better diet, you know, more greens and stuff. And they don't eat any seafood. They never liked it, thank God, you know. So what the hell is causing that, you know? Doctors don't know. They just, you know, write it off. Well, they just got some kind of a virus for a day or two, you know. Well, how can they continuously catch this virus, you know? What virus? Don't know. So.
She's got 2 boxes of this. She just had to go get done. And
So now, when he has a flare-up, we just try to, his parents just try to, you know, ride it out and hope he can beat it on his own, because the minute you take him to the doctor, they're going to want to put him on an antibiotic.
No medication, we have no treatment to make us better. So it's almost like, why go to the doctor in the first place? You're just throwing your money away because they're not helping. How do you expect them to understand that there's a problem when they listen to the media every day? A doctor doesn't leave his office to know that there is oil out there, that they are spraying Correx at 9,500 out there in the water still, and that the seafood's dying and people are dying. Because that's all hush-hush, swept underneath the rug. Out of sight, out of mind.